I think there was one more question before mine. For people who are trying to avoid going to the hospital after contracting COVID-19, what is a sign that they should go in?
Okay, so this is an interesting question. You have to follow your symptoms. So the second you know you're positive for COVID, that kind of starts your day one of kind of like looking at your symptoms. I would say if you have a chance, get one of these pulse oximeters and you can monitor your oxygen. If it falls below maybe 93, I'd go to the hospital. But I would say don't delay therapy. If you don't get better within 1 or 2 days, I would say just go straight to the hospital anyways, because it's better to be looked at by a healthcare professional who can monitor your symptoms and also look at your x-ray just to see how bad the COVID is. Because with COVID infection, we have a lot of great treatments such as Regeneron, monoclonal antibodies that work only if you're within a very short period of time. So within 7 to 10 days of getting infected, that's the only time you're eligible to get the Regeneron, and that will make your infection much shorter. So I wouldn't delay therapy. I would say wait maybe a day if you really want to, a couple days if you take your Mucinex or Tylenol or Dayquil. See if that helps. If you don't feel better, I would at least go to urgent care or go to the hospital because we have monoclonal antibodies that can help you get through your course faster. Yeah, so with that pulse oximeter thing, if you do get it and you're not COVID positive, check your baseline. That's what I always tell people. Check your baseline, see if it'd probably be 98 and up. And then check it while you have COVID. If it drops below 93, 94 consistently and you're gasping for air, I would definitely seek further healthcare attention at that point. And then, like I mentioned, I had that patient who was 24 years old, spent 12 days at home with COVID, thought they were getting better, but were sitting on the couch, laying down all day, and they ended up getting a clot. So making sure you're kind of just looking at how you feel when you're normal versus how you feel when you're sick and those sorts of situations. And if you check out my Instagram and you are someone who got infected, I do have some tips on how to test or when you should test based on the CDC guidelines. And I also have some tips if you want to take care of yourself at home. So if you have a mild infection, and also when to seek more medical attention. So I have some tips on there if you want to check it out.